Okay, good afternoon everybody. I'm Simon Banks, I'm the Chief Officer of NHS Holton Clinical Commissioning Group. I'm here representing about 25 organisations from across Cheshire and Merseyside. And our submission is about creating clinically and financially sustainable and connected women and children's services across that region. The submission is big in its ambition because it has to be. I can't pretend I can't stop acting, we can't stop acting and thinking big on these issues. This is the product of at least 18 months of creative conversations across providers, commissioners and clinicians. And we're wanting to lead a system-wide response across Cheshire and Merseyside to the challenges around increased demand on services, the presentation of people with more complex needs, the fact that whilst there is some excellent practice in place, there are unacceptable variations in the experience of people who use these services in some clinical outcomes, safety and quality. The organisational barriers have prohibited the change that we've seen in other parts of the world happening in our part of the world. We have workforce challenges in terms of recruitment, retention, retirement, skills mix and flexibility of deployment. Workforce is largely organisationally bound rather than works across a system. We have a growing challenge around the ability to meet regulatory and other clinical standards, whether set by the colleges or by CQC. We have fragmented commissioning, which the previous organisation bidding mentioned, and again the cost of services exceeding the income from tariff or other payment mechanisms. So no one organisation, commissioner or provider, can address these issues in isolation, and that's because the services are fundamentally interdependent. They have to work together. And we are wanting to address these challenges proactively and together. We're doing it through common purpose, through collaboration, cooperation and co-production. Doesn't mean we also don't have some fallings out as well. But we fundamentally care about the people who access these services, and we want to lead and deliver a substantial change in how they are provided, how they're commissioned, and therefore in patient experience and outcomes. And we're creating a new approach between commissioners, clinicians and providers that goes beyond organisations. This also engages the people who use the services so that we can create a more personalised offer that is also clinically and financially sustainable. But it works across our system because we need to change. We need to change how and where we deliver these services. And this is why we want the support of the New Models of Care programme to help us take this a step further, to help us develop an innovative and connected network-based approach to service provision and commissioning, and to be able to do this at greater pace. Helen.
Thanks, Simon. I'm Helen Schofield. I'm a consultant obstetrician. I have a background in primary care as well. And together with Simon and the members of the steering group of the Cheshire and Merseyside Strategic Clinical Network for Children, Young People and Women, Maternity Services, we've been working on this conundrum. The group's got a membership from patients and user groups such as the Children's and Young People's Alliance. We've got commissioners from clinical commissioning groups like Simon, but also NHS England. And we've also got the providers for the whole region and any qualified provider of midwifery services. So why Cheshire and Merseyside? Well, we're quite a nice size. We're about 2.5 million people, and we encompass an urban and a rural area. It's a region where 5 out of the 9 districts are in the lower quintile for multiple indices of social deprivation. 2 are in the next lowest and 2 are in the middle of the patch. So it allows us to deliver a model which is suitable for the needs of the most needy, but also transfers to a rural and more affluent population base as well. So we're not too big and we're not too small. So we'll be a great test bed for the new models of care nationally. So I would say that our vanguard has the potential to improve health, maybe give us a better innings, pun intended, in this audience of the whole population, okay, for equitable and high quality care. And we're going to achieve this by reducing variation and duplication. So we also are subscribing to the mantra that care must be provided as close to home as possible. But it has to be centralised when necessary, the right care at the right time, in the right place, by the right person. And this is going to be facilitated by network pathways and the use of digital innovation. So at the moment, services tend to firefight as a result of to disease, but we need to be much more proactive in all of our healthcare provision. and we need to recognise every opportunity we have to further the public health agenda, because otherwise all our healthcare is unsustainable. And prevention is definitely a better way forward, as highlighted by the CMO in her 2012 report, and even only yesterday in the Poor Beginnings document published by Public Health England. So why women and children's? Well, it recognises that the first years of a person's life have a profound impact of the whole of their life and into adulthood. And this begins before birth. And it's dependent on mothers' social and parental socio-economic status. So our proposed Women and Children's Health Network will facilitate a paradigm shift from the traditional model to a life course view of services. And this has been illustrated in a document from the Royal College of Obstetricians and Gynecologists. So we want to capitalise on the pivotal role that women play in the health of the whole nation, okay? So yesterday we heard about Mr. Jones. His carer is his wife, and so we're going to use all the contacts we have with her and her daughters to bring the service forward.
Hi, I'm Colin Morgan. I'm head of school for postgraduate education and in the Mersey region. I mean, our focus really has to be on redesigning the training of paediatricians and obstetricians within the Cheshire and Mersey region. We have to alter the programme and refocus our training away from our successes in tertiary care and start focusing a little bit more on primary and secondary care and develop a training model that allows us to use allied health professionals, including practitioners and associated healthcare professionals. And what we like from the Vanguard system and collaboration is to support in finding these innovative training programs and support for the development of a workforce that can be rotated and shared across a whole region so that we're focusing on the whole range of care pathways right through from the primary care setting with the primary care paediatrician in association with general practice right through to the tertiary provision where our model of care is a little bit stronger.
Thank you.
Thank you.
Stop you there. Thank you very much. So questions for the team from Cheshire and Merseyside? Table number 15.
Got the button change there in the end, thank you. Great presentation. Brent McInerney, I just volunteer in a social enterprise in Gloucestershire. I'm very keen on the engagement aspect of it, really, and particularly anything that you've done innovatively that have engaged people, engaged children and families that you might not have engaged before. My concern always is that we hear the voice, but is it the voice of, and you mentioned deprivation and socioeconomics, is it the voice of people that we've reached rather easily? I think you get my question, don't you?
Well, your baton change was better than the England relay team, at least in the recent championships. But thanks for the question. For the last coming up to a year, we've had a programme team in place that's been doing a lot of insight work, working directly with exactly the sort of people you're talking about. So actually going on, working with providers of maternity services, working with providers of the neonatal services and getting that additional insight on top of what the providers and the other organisations gather. And as Helen said in the presentation, the Strategic Clinical Network also has within its pathway work has patient and public representation. And also the two stories from colleagues from Wessex and from Alder Hey have resonance with me personally because this is a women and children's network and I've had experience of that obviously through wife and children but also through a disabled child, so there's a lot of resonance with that. So we're bringing our personal as well as our professional commitment to this, many of us across here, as well as hearing that voice. Is that okay? Did you want a bit more?
Table number 12, please.
I have to look at my watch. Good afternoon.
Hello.
My name is Trevor Clower. I'm a carer rep and I'm from Nottingham. I also work with the Nottingham Healthcare Trust, and I've been invited, it's quite brave for the Trust anyway, been invited to help design a training programme for carer awareness and also driving on that and been involved. My question is, have you got any plans, when you say you're going to retrain, have you got any plans on how you're going to design these retraining programmes and who you're going to include? And obviously, I'm a carer with listening to you intensely. Thank you.
Well, I think the programme of paediatric training, our services are currently very dependent on middle grade specialist trainees in paediatrics and also in maternity services. And the current model of care is suffering because of massive vacancies at that level, and we have major workforce challenges. And one of the problems is that we have a training model that focuses very much on acute and subspecialty care, which is why we're getting a level of excellence in tertiary care provision, which is a very positive thing. But it's like we're not really matching that with the primary secondary care interface, and the plans for training. The medical workforce are very much focused on subspecialty training and not focused to that primary care interface. So we need to integrate with general practice, reintroduce the concept of the primary care paediatrician. And although we've heard that's happening in pockets around the UK, what you need is a well-structured regional training programme that actually incorporates that style of training for every paediatrician. And then on top of that, we've got groups of allied health professionals, including nurse practitioners, which can provide us with all levels of expertise, whether it's in the community setting, in the intensive care setting. We can ensure that those practitioners are trained in a strategic way so that we are actually deciding what professionals we need in what parts of the region to provide what parts of the care, and then have a training programme and a training strategy for other health professionals, including nursing staff, to ensure that we're actually meeting the needs of the whole region. And when I come from a tertiary centre, and I know what happens is that we tend to suck in the expertise from around the periphery. So if you are setting up good models of care in your local community, we will often find that those professionals end up gravitating towards the centre. And what we need is a regional strategy to ensure that the local care and the expertise is preserved, so that the patient actually meets someone with the level of clinical expertise that makes good immediate decisions about their level of care.
I'm sorry, my point was to include a carer or patient
Yeah.
in the training program, designing and driving it forward, because it shows the professional what's happening at the street level.
Yeah.
And it gives them a feel of what's happening in real life.
And I think a lot of what I've just said really is driven by feedback from patients.
Feedback,
Mm.
talking about
Yeah.
inclusion.
Yeah.
Could I-
Designing the training program, it works.
Yeah, I agree with you. And I think that's why we want to put women's and children's together, because we do an awful lot in pregnancy already. We're working with the women and developing their caring potential. And we want to broaden that really into a more general population-wide setting.
I'm sorry, we're out of time now for questions. We only have 5 minutes for each set, so apologies for people that had their hands up still. So a big thank you to the team from Cheshire and Merseyside.